we're talking about physical diagnosis. So that's by wise diagnosis aspected. Yeah. And the first part is history taking. So let's do some compare. Yeah, let's do some compare. TCM diagnosis and Western medicine diagnosis. You just finish TCM diagnosis. Let's see what's the same, what's the difference. So for TCM diagnosis, we say we have 4 ways to make diagnosis. Looking, like looking patient's face, looking patient's tongue, looking the body. And then we hearing and smelling. That's TCM diagnosis 4 way. Yeah. We hear the patient's sounds. We hear the patient's breathing sounds and speak sounds at the same time. And also smelling the fever coming from the patient. Maybe the bodies, and maybe come the urine, maybe come the stool, or maybe come from the phlegm, if they have special kind of smell in there. And the inquiring. Inquiring means ask questions. We have 10 basic questions we can ask for TCM. Yeah. Like a fever, chilled, body ache, some questions. And finally, the last way, we say palpation. Palpation part, including the pulse. Yeah. Means the practitioners use the hand to palpation for the patient. Yeah. So that's the TCM you just finished. First part of TCM. Yeah. Second part of TCM, make a pattern diagnosis. Yeah. Make a pattern diagnosis. Like a spleen deficiency, or maybe liver young rising. See, my mouse is not working that well. Yeah. Let's see, I can do this way. Or maybe liver young rising. My finger is too bigger. Yeah. So that's the pattern diagnosis. That's the second part of TCM diagnosis.
Yeah, I did that last term.
Okay, good. Good. Yeah.
I don't know how good I am. It's hard, lots of things.
Lot of things, yeah. And that's pretty important for TCM. Yeah, review and review and review. Yeah. Okay, so now we're moving to Western medicine diagnosis part. So Western medicine diagnosis, we say we still pretty similar like TCM. We still have ask questions, inquiring. So ask question, inquiring here. So basically, we are talking about inquiring. Yeah. Side here. We say history taking. So like what happens before? Yeah, what happens before? So that's the inquiry. We still ask questions. Yeah, we still ask questions. We will talk about some detail later. Yeah, but generally say still ask questions. Yeah, still ask questions. And then the second part is physical examination. So physical examinations, we're still including looking, yeah, the same thing with TCM. We still have hearing, but it's different hearing. Yeah. For TCM, we're hearing directly coming from the patients, like the patient's sounds. They speak, or they barking sounds, or they cough sounds. But for Western medicine hearing, basically we need a microscope, 听诊器. Yeah. We are not means directly hearing from our ear. Yeah. So that's a different story. Yeah, different story. And then we still have palpation. So palpation, we're still including the pulse part. But for Western medicine pulse, it's pretty simple. Yeah. Maybe just the field pulse, how stronger it is, or maybe the rate. Yeah. Mainly for rate. Yeah. Even now the truly feel how stronger. Yeah. So that's for the palpation. But we have big part for Western medicine, palpation other part of the body. Yeah. Including the chest, including the heart, especially abdominal area, yeah, and the organs, palpation. So that's for the Western medicine. And for Western medicine, they also have a special way we call percussion. So percussion, usually we are not truly used for the TCM. Yeah. What means percussion? Percussion kind of a tapping way like this. We can use like a one hand percussion, or maybe we can use two hands. One hand putting on the skin, touching there tightly, and then percussion. So you use one hand percussion, another hand. And then we still hear the sounds. Yeah, we still hear the sounds coming from inside the body of the patients. So when we go to there, we will talk about more detail. Yeah. So right now, we just got some basic picture here. So we try to think about or matching with TCM diagnosis. So generally speaking, we put everything together here, whatever for TCM or for Western medicine. The first part, just take information. Yeah. We got the information from the patient. Yeah, got the information from the patient. What kind of information? Generally say about illness or sick information. So that's first part. For TCM, after we take information, will be good to make a diagnosis. Yeah. But for Western medicine, we have more. Yeah, we have more. We have laboratory tests, and we have some other assistance test examination. Then finally, together, make a diagnosis. That means illness diagnosis. Yeah. So our class, we talk about basically, yeah, we talk about basically, we talk about basically physical examination here. So that's basically we say we're only on the physical examination part. We are not go to the laboratory diagnosis part. So generally speaking, we pick up some information. Yeah. So we are not truly make illness diagnosis, but we truly take some information. So this part and also some technique we use, later on you still can use for your TCM like diagnosis. Pick up more information. Yeah, you have more way to pick up more information. And also give you some basic idea how to take information from the patients. And what's the symptoms, mainly relationship, what's the illness. Later on we discuss. So that's the basic picture about Western diagnosis. Any question here? It looks good, yeah.
Are you saving the class on the video?
Yeah, I try to save in the class.
So if we forget, we can go back.
Yeah. If we forgot, we will go back. Yeah. That's why I log into Zoom to see if some students in here.
No one's there.
Yeah, no one in here, but we still can record here.
Okay, that's good.
Yeah.
Somebody who is still there and can go back.
Yeah, that's what I would like.
Yeah.
That's a good idea.
Yeah. So now we say we are in the basically Western diagnosis part. And in this part, we still separate two parts, mainly two parts. So the first part, we say healthy history. So healthy history part mainly, just ask a question part. Yeah, ask a question, inquiry, ask a question. We ask the patient about what happens. And the second part, we say physical examinations. So physical examinations, that's the part we say looking, palpation, hearing, and also including percussion. So that's Western medicine, or maybe in our class, we separate the two parts here. Part one, inquiry. Or we also call it history taking. And the second one, physically examinations. Physically examinations, we have 4 ways for physical examination for Western medicine. But for different parts of the bodies, we may not necessary to use all the 4 ways. For example, for the head area, we may just looking and palpation, even little bit palpation in there, we can feel something in there, but not truly for percussion or hearing. But for the chest area and the abdominal area, we need to use all 4 ways to check the patients. So we have 4 different ways, but use for different part of the bodies. Maybe some part just use 1 or 2. Some part we need use all the 4 ways for examinations. It's totally depending.
Smelling isn't as important for the Western medicine.
Yes, spelling is not truly working for Western medicine, yes. So we say, the firstly, we ask a question, we also call it healthy history. Yeah. So the same thing, ask a question, inquiry. And the second part, we say physical examinations. We truly checking with the patients, yeah, to see what happens in there. Yeah. We totally have 4 way in there. Looking, hearing, percussion. Yeah, so basically 4 way in there. And after we finished, we need a recorder. So certainly clinically, you can record at the same time. Yeah, like you ask a question and then you record there. And then your physical examination, then you recorder. But generally say we need a recorder. Yeah, we need a recorder. So that's the whole picture for clinic, like we use. So not only for Western medicine, also for TCI. Yeah, also for TCI. Then we go to the first part. We say we are go to history taking. Means ask a question part. We go to detail. What kind of question we will be asked? Yeah. And basically we have some order there. Yeah. In case we forgot. Yeah. So we follow the order and then we ask questions. The firstly, we're talking about the chief complaint. We go to some more detail later, but generally say chief complaint is the patient's mainly problems. They're looking for the treatment. Yeah. So that's chief complaint. Yeah, that's chief complaint. So certainly when people come in, we ask chief complaint first. Yeah. What kind of help you need? Yeah. What kind of chief complaint? Yeah. So that's generally first questions. And chief complaint usually pretty short. Yeah. Just a couple words, mainly problems like headache. And also we can add in how long time in there, like 2 days or maybe 3 hours. Yeah. So that's chief complaint. Pretty simple. Yeah, pretty simple. Certainly we need to ask some detailed questions, relationship with chief complaint, like what kind of headache, yeah, and what's the time, especially it happens, have headache similar headache before or not. So that's detailed part. We say that's person illness, yeah. Anything relationship with chief complaint detail, that's we say person illness. Yeah, person illness. So the patient maybe not only have headache, like before they have other troubles, like they have sleep problems, or maybe digestion problems, but not directly relationship with chief complaint, like nothing directly relationship with headache. So that part we put on the past history. Yeah, if patient have some other illness, yeah, but nothing relationship with chief kaplan. So we say personal illness is everything directly relationship with chief kaplan. And the past history is nothing directly relationship with chief kaplan. But patient have illness. Yeah, patient have illness. So that's past history. Then we ask family history. Family history means blood relationship family members have some illness, especially some illness may be relationship with genetic reasons, like high blood pressure, like diabetes, yeah, cancer even. So we just ask family history, basically like mom, dad, or even grandmom, granddad, and the brother and the sisters, and even the son or daughters. Yeah, like a family, a blood relationship kind of family. Not including the husband usually. Yeah. So that's generally say family history part. They have some severe kind of illness. It's not like just common cold. Yeah. And then we ask, personal and social history. So this part, we ask a patient, like if they have some habit, smoke or drink, yeah. For the female, we can ask some periods, yeah. And also if they travel to special part of the country, and then they coming back, maybe relationship with some illness. So that's in this part. Yeah, we still go to detail later. And then we say review of the symptoms. Review of the symptoms is pretty bigger part. Yeah, it's pretty bigger part. So that means we ask questions follow the symptoms. Like we have big symptoms. We have lung in there. We have heart in there. We have digestion systems in there. So we ask some questions. We say from the top of the head to the bottom of the toes to see patient have some trouble there. So that's pretty big part in there. We're still talking about some detail later. So that's general picture. Yeah, general picture on or ask a question part. So that's basically for today. Yeah, basically for today. We just talking about what kind of picture we will ask. Yeah, and the order we follow. Yeah, and what kind of question we can come in with the like follow the order there. Okay, so let's go to some detail here. Yeah, which is say when we're talking about with the patient, the first few part. Yeah, first few part. So we say chief kaplan. We're talking about before, but certainly before we ask chief kaplan, usually we will have seeds and the paper will have basically like a general information in there. If patient did first time coming, certainly fill the name and the gender and the aging in there, and generally connected information in there, like a phone number. Sometimes people also like put an email in there. And married or not married, that's sometimes still relationship with some illness, especially sex transferred kind of illness. And also occupation. So occupation's relationship with illness also. Like some people, whole day, like need to use computer. They may easily got shoulder problems.
Or sore back.
Yeah.
Sitting,
yes. And some people, they working in some special factory, maybe have special kind of like chemicals, chemicals. Yeah. So that's why we need to ask patients, occupations. So that's just the general information from the beginning. Yeah, before we talk about with the patients, we take some general information from the patient. Then we ask for chief complaint. Yeah, then we ask for chief complaint. So chief complaint is the mainly symptoms patient looking for the treatment. Yeah. Just one or more, basically we're looking for one or two. Yeah, not too many. Yeah, not too many. So like patients say, I have headache 2 days. I couldn't sleep 10 years. So certainly we only put chief complaint for 2 days. Yeah. Sleep problems, 10 years is chronic problems. And maybe not especially coming for treatment. Yeah. So we can put 2, but not too many. Not like 10 chief complaint in there. We don't know which one we can treat. Yeah. So still like people headache, like 2 days, and sleep problems for 10 years. But they say headache is bad, but I couldn't sleep about 5 days, totally whole night I couldn't sleep. So that's certainly sleep problems is mainly important for looking for treatment. So we need to compare like which symptoms is more severe. It's mainly cause people trouble. Then we put in there. So that's chief complaint. That's the mainly problems. Patient looking for the treatment. You can plus time in there. Like 2 days, 3 hours. Yeah. And then immediately you know that's acute problems or chronic problems. So that's pretty short words, yeah, pretty short words in there. So some words about 10 to 20 words in there, yeah, not a long sentence in there, even less than 10 words in there. Just the mainly symptoms and the time. Then detail certainly like in the radio, they say chest pain, that's a chief complaint. Then ask more symptoms relationship with chest pain, like what kind of pain in there, and do you have some like a cough or other symptoms relationship with chest pain. Let's go to history of person illness. Yeah. So we say everything directly relationship with chief complaint. Detail in there. Then we put to personal illness. So basically we can put a different line there. Yeah, different line there. Like a first line, chief complaint, like in the radio, they say chest pain, like 2 days. And then we say person, yeah, person illness. Then we talk about sharp or dull pain, yeah, or radiating to the shoulders, or maybe have phlegm and also fever. That's pretty common. Yeah. So some other symptoms and how it happens, like 2 days before catching rain outside, and then go back home and get some fever and then chest pain. So everything relationship with the chief Kaplan. Yeah, how it happens. Yeah, how it happens. So let's go to person illness. Yeah, person illness. And everything not directly with the illness go to past illness. Like in the radio, they talk about, ask, do you have high blood pressure? He said, yes. That's illness, not directly relationship with chest pain. So go to past illness. And do you have diabetes? No. Some important illness, if they don't know, you still can put in there. So no, yeah. So that's past illness. That's the person. Oh, the P. Yeah, yeah. So past illness, nothing relationship, directly relationship with chief Kaplan. Yeah.
His mom had diabetes.
That's family. Yeah, that's family history. Yeah, yeah. That's not putting on the past illness. Later on, put a family history. Yeah, the mom. Yeah, like a mom the illness there. Yeah. So that's in this part is big part. We say in the radio is pretty short, but truly you can ask more detail. Like some illness happens in the children. Certainly some severe illness, not like just common cold, like a chicken pox, yeah, or some other illness. Some people got inflammations on the brain, yeah, that kind of severe illness. Yeah, tonsils out, yes. Yeah, pneumonia, yeah, still severe. Yeah, severe kind of illness happens in the children's time. And also happens on the adults, yeah. And especially when it happens, like 2 years before or 1 year before, so like in there. And if they happens, yeah, if they happens, like they ask hepatitis, if they take some medication, yeah, medications if they take, or maybe surgery if they take, yeah. So including some others like gynecology problems and mental problems. So some detail in there. That's go to like a past illness part, past illness part. So that's just basic picture in there. We finished, yeah, we finished chief Kaplan and the person, the illness relationship there, and the past illness. Then we go to family history. So family history, just the information, relationship with the, we talk about blood relationship in there, like parents, like grandparents, and also other family members like the father and the sisters. So some special illness relationship with family members, like hypertension, like diabetes, and even cancer. Yeah, some severe kind of illness with family relationship in there. Then we're talking about the personal and social history. So in this part, basically we're talking about some personal habit like drinking or smoking, and also like people specially travel for some special place. That's basically in this part. And finally, we say review of the symptoms. Review of the symptoms. We follow each of the mainly symptoms. We ask questions. Like in the radio, they ask other symptoms. So that's part we're talking about more detail later. We have a lot of questions in there. So before we discuss some detail, we go to two special words here. One word we say symptoms. Symptoms. One word is the signs. So these words sometimes they are a little bit confusing each other. So what means symptoms? The symptoms is patient's feeling. Patient's feeling. And then they tell you, like a headache. We couldn't see how patient's headache look like, but the patients feel it, and then they tell you. So that part belongs to subjective kind of information. We call that symptoms. Symptoms. And if after all examinations, like through the palpation, looking, or percussion, through the anyway, we have 4 ways to like checking the patient. And then we find the signs in there. We call the signs. That means objective kind of information. Like we can see patient have a big mark on the arm area. Including patient maybe you can see also, but truly we can see it. And the patient have abdominal mass with palpation, we can feel it. That's the size. That's the size. But the practitioner couldn't see it. Just the patient mentioned that's the symptoms of patient's feeling. Tell us that's the symptoms. So we will separate these 2 words. These 2 words. One is the symptoms, one is the signs. So, like we go to some detail. So that's the basic picture we finished already. So now we just go to some detail for each of the part. So that's we say we still start from the date and the time. Start. So that's like we go back here. So like everything we need talking about today, just on these 2 pages. That's just these 2 pages. Now we finish basic information about this part already. History taking. We just go to some detail. We just go to some detail. Like we start from the generally date here. Generally date here. So just repeatedly, don't confuse it. Don't confuse it. We just go to detail, one by one. So date and the time. Yeah, we just go to detail here. Date and the time, we say that's important. We know how exactly the problem happens, especially about the time part. Yeah, we need to record the time. And we know how long that kind of situation happens. So generally say, if pretty kind of emergency or important illness, we need exactly to know like how many hours it happens. Chronic problems usually not that severe problems, but acute problems truly is severe problems. And we need a recorder, like a patient coming, the date, yeah, patient coming date. Like today is September 8, 2020. And then we record today, the date. And when in the chief complaint, we talk about patient headache, 2 hours. Yeah. And recorder, we need to remember, recorder there, like a patient coming at 10 o'clock. Then we say patient headache 2 hours, means the headache start from 8 a.m. Yeah. If we are not a recorder, when we put on the field, just 2 hours, we don't know how exactly it happens. So that's we need to record the time, the date and the time we record for all the symptoms. So that's the first part. We need some special here. And we're still in the general information part. Yeah, general information part. We're talking about aging, gender, and occupation already. Yeah. So that's basically we need to know. And also some special part. Source of history. So that means if mostly, if patient can talking, they will talking to us directly. Yeah. But sometimes patients, some very severe kind of illness, they couldn't talking. Or maybe they lose consciousness. So we're talking about West medicine. Sometimes they sending to emergency. Yeah. They couldn't talking. Or maybe some special illness, they couldn't talking clearly. Yeah, also child, yes. Yeah, also child. And the people have mental disorder. Yeah, some special kind of situation, patient couldn't directly talking to us. And then we need to record where the information coming from. Yeah, if they are not coming from patient directly. So that's little bit partition here. We just go to some detail here. Yeah, some detail here. Then we go to chief complaint. And we still follow the same order there. Just go to some detail. Yeah. So chief complaint part. Yeah, chief complaint part. We say we try to use the patient's words. Yeah, patient's words. What the patient say. Yeah, what the patient say. Like a patient tell us they have headache 2 days. Yeah. So patient tell us stomach painful. Yeah, stomach painful. So just use patient's words. Yeah. And we say you also can add the time there. Yeah, how long? Yeah, how long time in there? we try chief complaint part. We try not to directly put the illness name there. For example, patient have like hypertension. Yeah, hypertension 10 years. Yeah, patient coming. They say hypertension 10 years, but the hypertension causes the patient feel dizziness or vertigo. We just put the symptoms there, like we just talking about the symptoms. We just put the symptoms there. We are not put the illness name there. We are not put the hypertension there. Yeah. So we put dizziness. Yeah, dizziness. Maybe like athletically, sometimes happens, sometimes better. 10 years and the worst 2 days. Yeah, we can put it like that. Yeah, but not say hypertension 10 years. So that's.
Sorry. I added it. It was echoing in my ears, so I shut it off.
Yeah, that sometimes. Yeah, yes,
Okay.
yes, still need to close.
Yeah,
Okay, yeah, that's all. Yeah, sometimes I use two computer there and cause same problems. Yeah. Can you off there?
Yeah.
Yeah. Okay. Yeah. I think there's still something in there. I think I can close. I can close for you. Let's see. It's okay there. Still might be something in there.
I know. I tried to shut it.
Yeah, the Zoom sometimes confusing.
Computers are.
Yeah. That's true.
It's better face to face.
Yeah, that's true. Okay. Okay, done. Okay, done.
I'll leave it.
Yeah. Okay. So that's we say the chief complaint part. Yeah, the chief complaint part. Symptoms. Yeah, symptoms. Yeah, patient's words. Symptoms. Not put the illness name. That's the mainly part in there. And then we talk about the personal illness. Yeah, personal illness. So personal illness, we just go to some more detail. Relationship with chief complaint. Yeah, relationship with chief complaint part. That's we say like how it happens. Yeah, onset of the problems. Yeah, onset of problems, and how it develops. And if patient got some treatment, yeah. So like people still say headache, yeah, headache 2 days, and gradually getting worse and worse, and they take some drugs or not drugs, yeah, or maybe some other treatment. So that's basically for person illness part. Just the detail about chief complaint. Yeah, just detail of chief complaint. So that's for person illness. And some more detail like we can ask in the personal illness part, like the location. Yeah, location. Especially for pain. Is on the head or on the abdominal area, on the head, final head or back of head. Yeah, abdominal area, left side, right side, upper, down. Yeah, exactly the location. And the quality. Yeah, quality. Quality means like what kind of pain? Sharp pain or dull pain. Yeah. And the quantity. Yeah, like how severe it is. Usually we can say, tell the patient, if the like up to 10, how much you feel? Yeah, it's 5, 6, or 7 or 8. So we know how exactly, how severe it is. Yeah. And the time, the time. So like start time, start time, that's on site, when it start. And when it during, like a patient say, I have headache, like start this morning, start at 8 a.m. and then after half hour, it getting a little bit better and relief. And go to 9 a.m., it start again. Yeah, so that's during and how frequency. People say, I have headache, like twice a week, usually. Yeah, so that's some detailed questions in there. And also, some other symptoms maybe happens at the same time. Yeah. Like each time patient have stress, then they headache. Yeah. So like what happens at the same time. And what can relieve it or maybe make it worse? Like put heat there, it relieves, or maybe get worse. Yeah. So what can relieve, what can make it worse? Yeah, some relationship. And some others, any other information important relationship with the chief complaint, with the problems. So we all can put in here, So that's present illness. Then we go to the past history, past history. Also, we can say past illness, yeah. So this part, we say start from patient, from the children, very young. If they have some special kind of illness, special kind of illness. So that we can record in here, So we can ask, like patient, do you got some severe kind of illness when you're young? Yeah. And so that's basically they will tell you. If on a special kind of illness, we can specially to ask if that's like a chickenpox. It's so popular. That's in the past history. And also people got adults and then they got illness. So for adults got the illness, we go to 4 aspects. Yeah, we go to 4 aspects. So some medicine patient may be take. Yes, some medicine patient may be take. Or some illness patient may be have. Yeah, we say some severe kind of illness. It's not like just common cold. So we say some severe illness like diabetes, and hypertension, that means high blood pressure. Hepatitis, we have learned the illness before, is inflammation happens in the liver. Asthma, asthma, and HIV. So that's a pretty severe kind of inflammation, mainly transmitted by blood and body fluid. And maybe some other information if patient have severe kind of illness and be in the hospital before. So that's about the medical part. Patient have some illness, they got the treatment, and in hospital before. And also especially if patient like have surgery before, especially surgery before, we need to record a special date, special date when they have surgery. And what kind of surgery, what kind of surgery or operation, treat for what kind of problems, like a patient have stomach cut off, gallbladder removed. So that kind of surgery and operation, we need to record it. Then in the past history part, we also talking about some gynecology problems. So gynecology, certainly, firstly relationship with the menstruations history, like a regular menstruations, and maybe have some special illness, and also something relationship like birth control and how many deliveries, is normal delivery or abdominal delivery, abortions, and also including in the sexual function part. That's still belong to past history if they have some special situation or illness. Then mental disorder, mental disorder. If they happens, if they happens, some special diagnosis, and if they still living in the hospital or get some special kind of treatment. So generally say in this part, the illness they have not directly with chief complaint, like the illness this time. We put for the past history. Then we move into family history. So family history, we say family members, family members, close relationship family members, and they have some illness, they have some special severe kind of illness. We put in this part, we put in this part. So the severe illness or the common illness, we say generally say hypertension, and maybe heart issue, coronary artery illness, like people have like heart attacking before, family member, I mean family member, have heart attacking. So that's we put in this part. Stroke, stroke. That's the illness happens in the brain, blood vessels problems. Maybe blood stasis happens in the blood vessels. Maybe the bleeding happens in the brain, and the patient got with stroke, with stroke. And the diabetes, we talked about a few times already. That's especially diabetes 1. Diabetes 1, diabetes 1. That's possible passing, like cause some genetic problems for children. And the thread, that's our gland, thread gland. Endocrine problems, endocrine system problems, or maybe kidney, kidney disorder. That's a kidney, right now it's kidney. It's kidney, right now it's kidney. And the cancer, and the cancer. If go to cancer, we record some special type or special location, lung cancer, or kidney cancer, or liver cancer. Yeah, we record it. Yeah. And arthritis. Yeah, arthritis, joint problems. Yeah, joint problems. And tuberculosis. Tuberculosis is lung illness. Yeah, is chronic lung infection. Yeah, chronic lung infection by the special bacteria, tuberculosis bacterial infection, lung infection. Yeah, asthma, everybody know, or maybe some other lung illness. That's we talking about family member here. And headache, yeah, headache. Syndrome disorder. People suddenly lose consciousness and then wake up. Yeah, usually it's brain's problems. Yeah, and mental disorder, and even have history for suicide. Yeah, suicide. People kill themselves. Yeah, suicide. And drinking alcohol. Drinking alcohol. Or some drugs addictions for long term. Couldn't stop drinking alcohol and couldn't stop to use some special drugs. Yeah. And allergy. So still there's some example here. Yeah. If some severe kind of problems, you still can recover here. Still can recover. So that's for family history. Then we go to the detail, personal and social history. So some detail here, we can go to some detail occupations. Yeah, occupations. So like from the beginning, we record a patient's occupation. If nothing special here, maybe in here, we are not necessary to put in there. But like we talk about the patient, they just say like a worker in the factory. But that kind of like a work, especially maybe touching or smell, special kind of chemicals. Yeah, we need to record here. Yeah, we can go to some detail in here. Yeah, so that's especially patient have skin issue, and if they work in the environments like touching special kind of liquid, and then maybe cause the skin issue on the hand. Yeah, and also patient have lung issue. They got a special pollution kind of smell coming from the work. That's we still can put some detail here. And then we're talking about some like other situations, relationship with the patients. Like a patient have maybe some special kind of stress, whatever, coming from the life, or maybe coming from the job, or maybe coming from the financial situations, we can record there. Yeah. And some life habit, that's including mainly like what kind of food they're eating. Yeah. And if patient do some exercises or not. Yeah. So that or maybe they take some supplements. Yeah, take some supplements. And they drink coffee. Yeah, they drink tea. Yeah, just the lifestyle or habit we can record in this part. Yeah, this part. And also some health care. Yeah, health care. Maybe patient do acupuncture once a week. Yeah, kind of health care. We still can record here. So that's for the personal and social history. Then we say review of the symptoms. Yeah. Review of the symptoms still a pretty big part. We still go to some detail later, but generally still ask questions. Yeah, still ask questions. We ask questions from the head to the toe. That's the whole symptoms, yeah, from top of the body and to the bottom of the body. So that's basically, yeah, basically. Certainly, if we ask like whole symptoms questions, it's take a pretty longer time. Yeah, maybe hours. You just ask questions. Yeah. We still can focus some important questions there. Yeah, like people coming with lung issue, we ask a pretty detailed relationship with the chest area and the lung area. And the other symptoms, we can just simply ask, do you have some digestion issue, or how about your stomach? So just general question there. So that's part, yeah. But generally say we need to have some picture about the question in your mind. Then they special coming from special symptoms. Then we can ask some detailed question there. So that's basically we say review of the symptoms. We just ask question, one symptoms followed by another symptoms. Some symptoms relationship there. So that's generally picture here. Yeah, generally picture here.